The next is from Persia 9. She says, I'm married 26 years to a man I now believe has AS. Although I would like to save the marriage, I cannot live the rest of my life with no emotional understanding or support from him. I feel like I'm dying inside. Can AS spouses learn, adapt, and evolve and relate to their non-AS spouse in a healthy way? So she's asking if he can evolve.
Yes, can, undoubtedly. But the issues are going to be a number of components need to be considered. First of all, by the person with Asperger's to recognize the characteristics. Now, I'm not suggesting that they must go for a formal diagnosis. It's more a question of acknowledging privately within the relationship that the descriptions of Asperger's syndrome apply to their personality and abilities, but it's kept as confidential. So the first thing is, well, yes, this is me. These are the issues I do have in terms of my ability to show the degree of affection you're expecting. I thought it was enough. I feel I'll disappoint you in many ways, etc. Or I may not understand your perspective. So the first thing is a recognition of the characteristics. The second is motivation. And sometimes the person with Asperger's may not be aware of the effect on their partner. They may feel, look, the relationship is going well, I'm happy, much better than when I was single, I'm okay, so you must be okay. I'm not really understanding that person's perception of the difficulties in the relationship, because you may have different expectations of that relationship. Now, the neurotypical may be looking for more communication, more intimacy, more compassion, a whole range of things that are anticipated in a relationship. But the person with Asperger's may say, I don't know when you need it, I don't know how to give it, etc. So there needs to be a sense of motivation to change. And once that person with Asperger's is motivated, they will change and they will be successful. One of the things I've noticed with those with Asperger's, when they take on board a particular topic or something they're going to do, they do it absolutely thoroughly and in a very determined way. Getting them on track, once they're on that track, they'll reach the destination, but you've got to get them on track. And so once there's motivation, we've got to check the degree of motivation of both parties for the relationship, where they see it going and so on. And then provide information. And I describe when I do relationship counseling with couples that I'm like a translator between two different cultures and two different ways of thinking. And acting as an advocate and translator for both parties, and to really learn how to relate. Now, there are some good books on this. Jessica Kingsley Publishers have two excellent ones, one by Maxine Aston, the other by Louise Weston. So jkp.com will provide you with a number of books primarily written by couples themselves of what they found successful. And also I do work with couples, and we do have a partner support group here in Brisbane, which gives a lot of understanding and mutual help. So yes, there can be progress along the relationship, but it's improving communication and it's improving mutual understanding. And usually it needs someone who knows about the area to help. Some relationship counsellors don't know about the area, and that can be confusing. If that's the case, there are books that I would recommend. Also, if there's a degree of embarrassment about those issues, then reading the books may be a private way of gaining the information. So yes, it can happen, can't guarantee it, but you need acceptance of the characteristics, motivation to change, and access to information and support.
The next question is from Lady Jane Grey again. She said, since the diagnosis for Asperger's, or the term Asperger's, is going to disappear and no longer be an official diagnosis, does that mean that people who have already been diagnosed are going to be, for lack of a better way to say it, considered cured and no longer qualify the support that they may be needing? How will it affect those also that are diagnosed with Asperger's in 2013?
Okay, an interesting question. I'm not on the panel that is DSM-5 in terms of looking at the diagnostic criteria. Now, my understanding is that the descriptions of Asperger's syndrome will still be absorbed into the new system, but the term will not be Asperger's syndrome, but mild autism. So all the characteristics that we would use for the diagnosis will be there, but the word will change. So it's not a question of being cured. So the assumption would be those who have a diagnosis of Asperger's syndrome would now be saying mild autism, as they just changed the terminology. I have major issues with the term mild autism, and I do think the term Asperger's syndrome is not past its use-by date, and I think it should be continued clinically for a variety of reasons. But really the question is based on, will such individuals no longer qualify for support? They may do, but my concern is if you use the term mild autism, certain organizations may use the term mild as meaning doesn't need help or understanding. Mm-hmm. So I am very concerned about replacing Asperger's syndrome with mild autism.
Mm-hmm. Is there something we can do as a population that basically has invested in this name and find it as a form of identification? Is there something we can do to help that panel to take a closer look at whether or not the name should go away?
I think that's very important because they need to realize the consequences of what they're doing away from the isolation of a committee room. Mm-hmm. And it's being organized by the American Psychiatric Association, APA. They have a web page, and you can go onto that web page and I think just send them messages of your personal thoughts on the changes. If you go onto the web page, they will give you an explanation of the changes that are going to occur. I'm not sure who to contact on the web page, but I do think that information needs to go to the American Psychiatric Association, what your thoughts are on the proposed changes.
Okay. Maybe we can start a groundswell to make sure that they give it as thorough an evaluation as they possibly can.
I think that the consequences are going to be quite considerable, and people need to know to look beyond the academic and look at the clinical and personal implications of what they're doing.
Mm-hmm. Mm-hmm. I know that on Autism Hangout there's a fair amount of discussion that talks about the fact that people look at this as a way to identify who they are, and the term mild autism, they just voice what you've said. It's something that could be dismissed because it's mild versus Asperger's syndrome.
Yeah, I mean, if we're going to get rid of the term Asperger and replace it with something else, I could think of something better than that.
Yeah. Well, maybe that's for a future conversation.
Yeah.
But that's all
but if people would contribute, if the term Asperger's is going to be dismissed, do you have an alternative?
Maybe we've got somebody like Ivo that's got an idea. I'll put that out there too. Dr. Tony, I want to say thank you for your time today and answering these questions. As always, this is so insightful and it's so helpful. I hope we get a chance to do this again soon in another month or two.
Yes, I think if we do it a January one, I live in Australia, so that's our summer season, which means I have sort of fewer commitments. Although I am writing over the time a book which will be on how adults who are considering whether they have Asperger's syndrome, whether they do indeed have the characteristics, and who to go to for help. Because I'm finding increasingly the referrals of adults who, a brother or sister or a parent, colleague at work, or having a child with Asperger's, the suggestion has been, maybe you have Asperger's syndrome, mm-hmm. and it's where they can start reading information in an easy-to-read, not a big textbook, description of what the characteristics are, to really say, well, okay, if these are the characteristics, it's quite legitimate for you to seek a diagnostic assessment.
Yeah. Is this for Jessica Kingsley?
Yeah, this will be for Jessica.
Excellent. Okay, well, good luck in your writing. As always, I want to say thank you again for your time today, and I look forward to our next conversation.
Well, thanks, Craig, and all those watching this video.
And thank you, Autism Hangout, and you folks at YouTube. We'll be back again soon with another Ask Dr. Tony.